So good afternoon, everyone. On behalf of the organizing committee, it's my privilege to warmly welcome you all to today's session under our international guest lecture series, Global Health Dialogue. So we are delighted to have participants joining us from across India and international also for this highly relevant session on patient safety and risk management in Operation Theatre. Patient safety lies at the heart of quality healthcare, and discussions like today's play a vital role in shaping competent, safety conscious allied health professionals. Before introducing our esteemed speaker, I would like to take a moment to acknowledge and express our sincere appreciations to the leadership of the Operating Room Global TORG USA. We extend our heartfelt gratitude to the CEO of TOG, whose visionary leadership and commitment to global collaboration in preoperative education have made initiatives like Global Health Dialogue possible. It's now my honor to introduce our guest distinguished speaker for the today. Ms. Oluwatoyin Akinlade is a respected global healthcare professional and a member of Operating Room Global TORG USA. She serves as an assistant professor of nursing at Adams University, United States of America, and is deeply involved in advancing patient safety, preoperative standards, and risk management practices across diverse healthcare settings. So we are confident that today's lecture will strengthen your understanding of patient safety principles, enhance your awareness of risk management in the operation theater, and inspire you to uphold the highest standards of the professional practice. Once again, we extend a warm welcome to Ms. Oluwatoyin Akinlade, and we sincerely thank you, TORG, and its leadership for their continued support in promoting global health education. Ma'am, the session is yours now.
Hi, everyone. Good afternoon. It's morning where I'm from, but good afternoon, everybody. It's a privilege and an honor to be here today. Everybody's looking great. And I want to say thank you also to my CEO, Ms. Adebusola. She's here today. I know as the time goes by, she's going to say one or two words to us. Thank you so much for having me. And I'll just get straight to it. Give me 1 second to share my screen. Okay. So to top this. I can find it somehow. I'll get to it. Just give me 1 second. I can't find my screen. Okay. Okay. Can we all see my screen? Can we see my screen, everybody? Yes, no? Can we hear me? Okay. 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 All right. So I'm going to get to it then. Okay. So this morning, according to what I got from the organizer of this program, we're going to be discussing something very important, and we are going to be talking about patient safety and risk management in the operating theater or operating room, depending on what you want to call it. I want to ask again, I need someone to maybe unmute and tell me, can you see my first slide? It should say patient safety and risk management in the operating theater. Can you see that? Anybody?
Kindly unmute yourself and just answer. I want this session to be much interactive.
Yeah. Can someone just unmute themselves and Just tell me, can you see my first slide? It should say patient safety and risk management in the operating theater. Yes, no? Okay. All right. So this session will focus mainly on also understanding. I know with students, so I try as much as possible to streamline it in such a way that it's going to be student focused, because that's what you need for now. So it's just going to show you or let you know and let you understand patient safety principles, common risk in the operating theater, operating room, and the roles you play as students in preventing harm from getting to the patient, to yourself, and also to the team as a whole. I have some objectives here, and one of them is that you'll be able to define safety and risk management at the end of this session. And also you'll be able to identify some safety risks that, we see in the operating theater. And then you'll also be able to understand evidence-based safety strategies that are very important for you to know. And then you'll be able to recognize your role in promoting patient safety. Right. So we have to ask ourselves a question. Why do we think safety matters? Why is safety something very important? Remember, we're not dealing with papers, we're dealing with lives. When they come into the operating room, they're literally giving or submitting their lives to us to say, help me. So when they are asleep, when they are prone to all the things that can happen, they need someone who's going to be their advocate. They need someone who is going to be someone watching out for them. And that is where we all come in, everyone working in the OR, you as a student inclusive. So patient safety is the prevention of harm to patients during healthcare delivery. This healthcare delivery means all that is going to happen from pre-op to when the patient gets into surgery, to when the patient is out of surgery, and also to when the patient is being discharged either to the ward, to the floor, patient is going back home, wherever the patient is going to. Surgical care involves complex high-risk procedure. I can hear some background noise. I don't know if that is coming from me, but I can hear some background noise. Okay. So surgical care involves complex high-risk procedures. All the procedures, think about all the things that can be done to a patient in the OR. Don't think about the procedures as this is a minor procedure, this is a major procedure. Think of all the procedures as high-risk procedures. You don't want anything to go wrong, even if it's a minor procedure, as we kind of classify them in the OR. You don't want nothing going wrong. So you have to be on top of it, making sure that everything that is being done well, so that patient comes in and then goes back home or to the floor well as well. There are many surgical errors that are preventable. Think of all the things that can happen from pre-op. Somebody refused or somebody forgot to confirm their allergies, and that's the same medication you're going to be giving them. And because nobody knows that this patient has this allergy, the patient is taking that kind of medication. I'm just giving all the scenarios that can happen. Then when they leave pre-op, they get into the OR, somebody had forgotten to maybe use a safety belt on them, and then the patient rolls off of the operating table, and then patient fall off. Meanwhile, patient is already intubated. Or someone, maybe the anesthesia provider, maybe takes a medication, it's on label, puts it on their table, and you as a student, maybe you're working with the anesthesia provider, they ask you to push the medication. Meanwhile, the medication that's being drawn, you don't know what it is. Perhaps the anesthesia provider does not know what it is as well, causing harm to the patient or can cause harm to the patient. And then patient safety improves outcome, trust, and quality of care. When the patient wakes up, when the patient finds out that everything went well in surgery, when the patient finds out that nothing is, they see their body, nothing does not seem off, then it's going to improve the trust they have in you as their provider, you as their care person, as their nurse, as their anesthesiologist, whoever it is in the OR, and of course the quality of care. They're now going to be the ones telling all other people in the community that these people do well. They're going to be giving the hospital good ratings, and then it's going to attract some more people to come get care in that same facility. According to WHO, which is World Health Organization, it says millions of patients experience surgical complication annually. Millions. It's not just thousands, millions of patients, of things that should have been picked, of things that shouldn't have happened, but people still get them annually. That is every year. Okay, so now let's talk about patient safety. What does it really mean? It means that you want to prevent errors before they occur. You don't want the error to occur, then you now start running here and there, getting or trying to seek for solutions. It's always better. Can the organizer please maybe mute every other person for now? It's always better for you to prevent errors before they occur. You don't want errors to occur and then you're trying to salvage the situation. It's better for you to be on top of it. Think about things that can happen and then start thinking about what you can do even before they happen. Then you also want to reduce harm when error happens. Sometimes you try all you can, but to some extent, the error still happens. Now you're trying to reduce the harm that the error can cause as much as possible. Now that the problem has ensued, what are the things we need to do? One of the things I would also say is when error happens and when the patient is up, you cannot keep that error from the patient. You have to explain to the patient what has happened, what are the things you've done, and what are the things you're going to be doing. It's not a blame game. It's just for you to take responsibility, let them know that it happened, and let them know that everybody is remorseful. Let them know what are the steps that you want to take and what are the things that you think the patient that can happen to the patient and what are the things that they can do or they should do should in case all this thing happens to them because of that error that happened. Then also you want to create a system that supports safe care. You want to create a system where everybody is bold enough to come out and say something like this happened. You don't want to create a system whereby you play the game, blame game, and then nobody wants to come out to say, I made an error of giving this patient an additional dose of medication, even though I've given the first dose. So you want to create a space that everybody's free, everybody's not burdened to give or to say whatever it is that they've done wrong, and then they take responsibility and then look for solutions to what has happened. Patient safety is shared responsibility among all healthcare team. As a student, if you see something wrong, even though you think you're a student, you want to report it. If you see something going wrong, you want to ask questions. Sometimes, maybe the person that's about to perform the procedure, sometimes maybe they just absent-minded and they don't really know what is going on. For example, if you're a student, you see that before they drape the patient, you found out that they've not use the safety belts across the patient. It's something you can talk about. Oh, are we not using the safety belts for these patients? You might find out that sometimes it's just that they're absent-minded and they forgot it. But because you said that, now you're keeping the patient safe. So you have to say something when you see something. Okay, let's talk about risk management. Do we have anybody with any question? I want you guys to be interactive with me. If there's anything, mute yourself, ask me questions. But if you think there are questions you can ask after the presentation as well, I don't mind. But I just want an interactive session. I want us to talk. I'm talking to you and I need you to talk to me as well. Okay, questions? Anybody? Okay, I'm going to continue. So for risk management, what's involved with risk management? Of course, as the name implies, there's risk. Now, how do we manage the risk? One, you want to identify any potential thing, that's potential risk, anything that you think can happen even before they happen. Any problem at all, you want to identify them and then start finding ways for you to, manage that risk. Then you want to analyze the cause of error. So the error has occurred. You want to find out exactly why did this error occur. You don't want to blame someone that really, made the error to happen. You want to find out why that error happened. You'll be surprised that it's because somebody did not do something that they're supposed to do and then that error happened. I'll give you an example. There was a time in one of the hospitals I've worked that, I don't know if you know the way they package potassium chloride. Potassium chloride is packaged in such a way that it looks exactly like saline that you use, it's a diluent that you use to dilute powdered medication. And you cannot push potassium. Not on any occasion can you push potassium. So imagine someone not looking at the package of potassium chloride and thinking that's a diluent, thinking that's saline, or thinking that's sterile water, and using it to dilute the kind of antibiotics and then pushing it into the patient's vein. And then the patient just, goes into arrhythmia and the patient dies. So they had to correct that by talking to the pharmaceutical company by saying, no, you cannot do that, because what if it's in an emergency? Although you're supposed to check and double check what you're picking from the cart when you're picking anything, but what if it happens because it looks the same? So these are the things that you want to find out and then you want to correct. Then you want to implement strategies to reduce them. What are the things you can do? Are we having long surgeries? What are the ways that we can tell the surgeons we need you to change your gloves? After how many hours do they need to change their gloves? And like I said, even if you're a student, if you think or you know that this is when this has to be done, speak up, say something. You might not, you might be, the word is, you might feel like they might think that your voice does not matter. It matters a lot. If anybody is in the OR, wherever it is, your voice matters. So if you see something or if you know something or you think something should be done, then say it. Then also you want to monitor outcomes. For example, patient is on a maybe blood transfusion, patient is on some kind of medication. You want to continue to monitor what the patient is taking. You want to continue to monitor how much the patient is bleeding. You want to continue to monitor, say for example, maybe it's a case of maybe the patient is bleeding at an accident or something. You want to continue to monitor how much fluid the patient has taken by just keeping it somewhere, not trashing it, how much bags of blood the patient has taken. All this matters because you don't want to overload the patient. I'm just giving a scenario on that kind of aspect. The goal here is for you to prevent error. You don't want to assign blame. I think I've said this earlier. You want to prevent error as much as possible and not assign blame to say you are the one that caused it, you are the one that caused that. No, the goal is for you to make sure that errors does not happen. If it happens, why does this error happen? And not assign blame to the person that's caused the error. Okay, so why do we always say that operational theater or operating room is a high risk place? It's a place where the risk is heightened and you want to do everything as much as possible to make sure that that risk is either reduced or it doesn't happen at all. So one of the things is because the things that we do here, most of the procedures are invasive. There are some that are not really invasive, but most of the procedures are here invasive. Invasive means that you're going into the blood, you're going into the cavity, you're going into the veins, you're going into the artery of the patient. That means you're going or poking the patient somewhere or opening up the patient, and then if that happens, that means the patient is, open to you. The patient is saying, help me, and then it's invasive because anything wrong happens can, take the life of that patient. So we have to be very careful. Multiple professionals also work simultaneously. Like I said, we have the anesthesia provider, we have the surgeon, sometimes the person assisting, you have the nurses, you have the everybody in the OR. We have students as well that come into the OR, although they have designated places where they put them, but everybody is working simultaneously in the OR. And that is why it's considered a high risk, because this person is doing one thing, that person is doing another thing, all for the patient. But at the same time, we have to remember that the goal is to help the patient. So everybody has to work together, not disjointed, and then error happens when it's disjointed. Eye alert medication are also used sometimes, especially for anesthesia provider. They use all these medications to keep the patient sleeping, to make sure the patient is relaxed. All these kind of medications are eye alert medications, and giving these medications means that they have to be alert themselves to know when something is going wrong, and if it goes wrong at all, they know exactly what to do so that they can bring back the patient to how the patient should be, in case anything goes wrong. Then time pressure is also very common in the OR or in the OT, depending on what you want to call it. The goal is to make sure that the time we're using in the OR is reduced as much as possible. You want to do all the things you want to do for the patient to make sure that whatever it is that you're helping the patient with is done, but at the same time, you don't want to keep the patient in the OR for too long because of so many reasons. You don't want to keep them staying in one position for long. They can develop thrombosis, they can develop thermoregulation problems and all of that. So we want to make sure they're in the OR to get what they want, but at the same time, you want to make sure that the time is reduced as much as possible so they come in and then they out. Small error as much as possible can lead to serious harm. You might think it's just a small error. For example, maybe you put a cannula on the patient, all the IV thing on the patient's hand, and then you took out the cannula, but you did not check to make sure the cannula is complete, for example, and just a tip, very tiny tip of the cannula is broken into the patient's vein, and then that causes problem, travels somewhere, cause a problem somewhere. It might look very small, but can cause a serious problem for the patient. That now they have to take the patient out somewhere and then get a vascular surgeon to get it out and all of that. So you want to try as much as possible to reduce the error as much as possible. Some common safety risks that we find out in the OR, one of them that is very common is wrong patient, wrong site, and wrong procedure. So if you're a patient, or if you're a student and maybe you're following, or somebody is precepting you, you follow the person to see the patient even before they bring the patient in. You want to make sure that the patient knows their name, their date of birth. You don't want to use room number to say the patient's in room number so, because they might have changed the patient, move one patient from the room to another room. You don't want to assume. You want to go in, you want to call, ask the patient, can you please tell me your name, for example, tell me your date of birth. And then most of hospitals now has handband, and you want to confirm that to the handband of the patient to make sure that the name and the date of birth that they told you is correct with who you have. Then you want to ask them that, what site are we operating on? Even if the patient knows, you still want the surgeon to come in to mark the site, especially if there are sites that can be marked. You want them to mark the site to say this is where we're operating on, so that when we get to the room, we are not confused and say is the right, is the left, and everybody is arguing. And if that's happens for any reason, maybe the surgeon is saying is the right top is saying is the left, the nurse is also saying is the left, there's no connection with what everybody is saying in the room, then it has to pause. Even if the patient is under anesthesia, most of the time they have to wake this patient up and then trash it. Make sure that they know exactly what they need to do before they continue. Then also wrong procedure. Maybe they have to take out the right kidney, for example, but for some reasons, they're taking out the left kidney. That can happen. Then another thing that is very common is retained surgical items. Maybe they forgot to count the number of Ratex they're using. Those are small gauzes that they use, or they forgot to count the number of towels they're using, or things like that. And then after the procedure, they forgot one of those things inside the patient's cavity. And then you can think of all that can happen from forgetting something like that, as small as that, inside the patient's cavity. And then the patient comes up with surgical site infection, comes up with a lot of things that can happen from that. Then, of course, medication and anesthesia error. Calculation of medication, calculation of amount of anesthesia gas, and all of that needs to give to patients needs to be well done, especially by anesthesia provider. You don't want to undergive, you don't want to overgive. You want to make sure you're giving the correct amount of medication that the patient needs. Some human factor and errors that can also happen. One of them is fatigue. So think about someone working maybe for 4 days in a row, back to back like that for 4 days, and at the same time they have to work maybe 16 hours, 18 hours for that 4 days. So one day they're working 18, then coming the next day they're working another 18, back to back like that. I know shortage of staff is everywhere, so think about something like that happening, and then because of that, error happens. They've not slept well, their eyes is not well opened, they're calculating the medication they want to give, but because they're tired, they're fatigued, they making mistake because of that. When there are distraction and interruption, I used to say in the OR, when you have the opportunity, when you think the noise is getting much, when you think people might not be concentrating, even as a student, you can say, this OR is noisy. Say it to someone. If you don't think you want to say it out and then everybody is looking at you, say it to someone like, why is the OR so noisy like this? Everybody has to be calm, especially during induction. Induction is when they put the anesthesia in, they want to make the patient sleep and all of that. So you don't want to be making all sort of noises when that is going on. So another thing is also poor communication. Anesthesia provider is not talking with the surgeon is not communicating with us. Everybody's just disjointed in the OR, and nobody's communicating with anybody. This can cause errors on human part. Then fear of speaking up due to hierarchy. That's just what I said now. Even if you're a student, speak up. If you see something, say something. If anything happens, if you're in that OR, you're going to be called. I'm sure most of us have heard about, cases and all of that. Everybody in the OR is going to be summoned. So if you see something, say something. Most error results from system failure, not really individual negligence. Like I said, it's because somebody is not doing what they're supposed to do. It's because somebody is not creating an avenue to help the people in the OR. Things happen, and if you find out that this is system failure that is causing the error, then you want to fix the failure so that that kind of negligence or that kind of error does not occur again. Any question so far? Anybody? No? Okay. Okay, the next one we're going to talk about that is also very common is infection prevention in the operating theater. So infection happens, especially surgical site infection, we happen about 30 days following surgery, and so many other kind of things that can happen after surgical site infection. So we want to prevent infection so that the patient feels safe, not only when they are with us, also when they're out, and then they can, just like I said, they can be human form of kind of communication to others to say, this hospital is doing well, you want to check them out. One of the key strategies that you want to use in preventing infection here is, one, you want to make sure that you're properly scrubbing your hands. As surgical personnel, you work in the OR, even though you're not touching the patient, even though you're not the surgeon, even though you're not the assistant, even though you're not the scrub person, the scrub nurse or scrub tech or whoever, I used to advise, even though you're the student, you're the nurse, whoever it is, make sure you're also scrubbing your hands, especially when it comes to you entering the OR. Scrub your hands, make sure you're wearing your proper PPEs, wearing your mask, wearing your headgears, wearing your whatever you need to wear. Then also remember that you have to maintain sterile fields. As students, when you get in there, you see them saying, can you move to this side? Can you move to that side? It's not because they're really mean. It's because they don't want you to contaminate the sterile field. Because think about it. If you're the patient that they're operating or the patient on that table, would you like it if someone, they've set up a sterile field that they want to use for you, if someone comes in and then contaminates that field, and because of that contamination, you get infected? So I used to think about that at the back of my mind, that I want to take care of this patient the same way I want to be taken care of if I happen to be the one on this table. So when you have that at the back of your mind, it helps you to see things on the patient's side, and then you can do the right thing by the patient. Then you also want to maintain environmental cleanliness. You don't want to perform one surgery now in an OR and then it's not being clean, and then you bring the patient in, another patient into that OR for another surgery. That is wrong. You want to make sure that people that has to come into the OR to get the OR cleaned, to make sure that it's ready, and then they can now set up their table again and then do another procedure, are there to perform that kind of activity. The following protocols reduces surgical site infections as much as possible. When you try to do all of these, so many other also happens or can be done depending on your facility or what you do. Once this is done, another way that I think I know for most of the facility I've worked is they try to reduce the number of people in the OR as much as possible. So sometimes if they find out that the number of people in the OR is too much, they tell some people, when I used to scrub or when I used to circulate, if I find out there's so much people in the OR, I am not afraid to say, can 2-3 people please move out, even if they're surgeons, but they're not doing nothing. They have to get out of the OR. It's not because I'm trying to be mean or because I'm trying to, ascertain or try to make them feel like they're not wanted, but because I want the patient safe. Too much people in the OR when they're not needed does not make any sense. So they can step out. For students, they can be at the back of the door watching as much as possible. So if you don't need it in the OR, you can step out. Okay. There's a checklist that's being used for safety. Most institutions uses the WHO checklist, and for this checklist, what it just helps to do is it improves the communication in the OR and also the safety of both the patient and also the providers. And it includes the sign-in time. So there are sections in that checklist. We have the sign-in, the timeout, and the sign-out. So for the sign-in is before anesthesia, so before the patient is given any form of anesthesia, even if it's a very minor one, you want to make sure you do this part. So we're going to see that checklist in my next slide. And then timeout is before incision, before the surgeon, before whoever is performing surgery. Most of the time surgeon puts the scalpel on the skin or wherever the surgery is going to take place. Before they do that, you want to do a timeout, and you also see what it contains. And then a sign out. This is before you leave the OR or OT, and you just want to find out if there's any problem that went wrong, if there's anything that anyone of the team has to say about what has gone, what they've done in the OR, anything gone wrong, anything they can improve on. You want to talk about this before they go. Nobody leaves the OR. Nobody, even the surgeon. Nobody leaves the OR. No student leaves the OR. Nobody leaves the OR until the sign out is done. With all of this, it shows that the studies have shown that it significantly reduces complication and mortality. Complications are things that can cause morbidity, and of course, mortality is deaths that can happen from all these problems happening. This is what the surgical checklist for WHO looks like. And like I said, The session where you see the before induction, you want to ask them, as the patient confirmed his identity, for example, have you confirmed the site and procedure? So everybody is confirming it. And you remember the patient is not sleeping. So if there's a problem, or if there is a mistake somewhere, maybe the patient says, my name is Anita, for example, and then everybody is saying this is Rohit, for example, then everybody knows that this is wrong. We're having a wrong patient. And then, of course, if the site is marked, you want to find out if the site is it's a place that you can mark. Is it marked? If it's not a place that can be marked, then you of course tick that is not applicable. Then, is the anesthesia machine and medication check complete? You're going to be facing anesthesia provider and asking the question, is this done? And then the anesthesia provider is going to confirm yes. So you want to hear that yes from the anesthesia provider before you check the site. Then, is the pulse oximetry on the patient functioning? You want to find out, is the pulse oximetry functioning, and you can see from the monitor of the anesthesia if it's functioning or not. If it's done, the anesthesia is also going to say yes, and then you tick that place. Does the patient have an allergy? So if there's a known allergy, you want to mark yes. Well, some of the time they want you to write the allergy in front. So mark yes if the patient has an allergy. If no, if the patient doesn't have an allergy, of course you mark no. Then difficult airway aspiration risk. Do you think this patient has problem, or is going to have problem with breathing, or the patient can aspirate, depending on so many factors? If the patient is obese, for example, if the patient has conditions like OSA, for example, so many things. So if you think the patient has a risk, of course, you mark yes, and then they want to find out from you, are equipment available in case this happens? What are the things that you have in place to help this patient? It has to be in the room. It's not that you say you go bring it from wherever it is. It has to be in the room just for helping with that immediately. Okay, the noise is gone. Okay, so the next thing you want to ask or you want to know is, does this surgery or does this patient has a risk of losing more than 500 mils of blood? And if it's a child, do they have risk of losing 7 mils per kilogram in that child? So if that is something that's yes to, then you want to make sure that you have at least 2 IVs. I'm going to ask this later. Does anybody know? Let me ask it now. Does anybody know why you want to have 2 IVs, or maybe central access and fluid as planned, just in case the patient has a risk of losing 500 mils of blood, or if it's a child and then they have the risk of losing 7 mils per kg? Why do we want to have 2 IVs and central access and fluid planned? And somebody unmute and tell me. Think about it. Why do you want to have 2 IVs for a patient that you think they can lose 500 mils of blood? Why? Someone? Anyone? No one? Okay, I am gonna go back to it. So somebody wants to say something? No. Okay, so you want to have 2 IVs or central access, because of course they lost, or they have risk of losing too much blood. In case they lose that, at least you want to give fluid to increase or serve as an expander, and of course you want to use the other access for blood, for some other medication that are very important the patient can take if this happens. Then the next one is you want to find out, or you want to do another timeout before incision, and then you want to find out about all of this. Everybody has to confirm their names and their roles. Everybody has to say who they are. Even if you're a student, everybody in the room has to say who they are. Then everybody has to confirm the patient's name, the procedure we're doing, and then where the incision will be made. Everybody has to know. Excuse me. Then they want to also know about antibiotics, which should be given within 60 hours before incision. So you want to find out, as the patient has antibiotics, and then is in within 60 minutes of before incision. So it should be between 60 minutes before incision. Incision means before the surgeon puts the scalpel or the blade on the patient to cut. Then you also want to find out about anticipated critical events that can happen both to the surgeon or that has happened to the surgeon, anesthesia provider, anesthetist, and also to the nursing team. Then if there's a need for imaging, is the imaging displayed? Do they have access to it, so that in case they need to look at the imaging again during surgery, they have access to that. Then after the surgery has been completed, before anybody leaves the operating room, somebody saying something? Okay. Before anybody leaves the operating room, the nurse will verbally confirm the name of the procedure that was done. Sometimes the procedure that that they plan to do might be a little bit different from what has been done. So that is why you want to confirm this, to make sure that the procedure that is being done is exactly what is being done, or if there's a change, then you can update that on your side as well. If there's any specimen, then you want to count the instruments and sponges. Remember, we said sometimes they can forget all these things in the patient, so you want to count to make sure that everything is complete. And of course, you want to ask the surgeon, the anesthetist or anesthesia provider, and the nurse if there's any concern. So if there's any concern for recovery or management of the patient, now this is the opportunity to say these are the things, and then what are the plans that they have to help mitigate that concern. Okay, so for medication in the OR or OT, majorly for anesthesia provider, you want to find out, or you want to make sure that they're doing it in such a way that the errors can be reduced, because if that error occurs, they are life-threatening. You can imagine pushing a wrong medication through the vein. So if it goes through the vein and it's the wrong medication, for example, like the potassium that I talked about, the patient can die in minutes, in seconds as well. So you want to make sure that no error is occurring, especially with medication. One of the things you can do is to make sure that you're practicing labeling all syringes. I used to say, if you are not the one that draw the medication, do not give the medication. If you are not the one that draws that medication, do not give that medication. Even if the person tells you, yeah, that is what I put in that inside that medication, you do not know what the person puts inside the medication, even if it's labeled. So if it's not you, let the person, whoever it is that has done that, let them complete their job. Then you also want to double check medication, especially medications that are high alert. You want to make sure you're giving the correct dosage of medication. Then you want to be extra cautious with high alert drug as well. And then you never assume or guess. You should not say something like, I think this is what I have in this syringe. I think that is what I have in that syringe. You have to be sure of exactly what you have in those syringes before you give that medication to the patient. Okay. The next I'm going to talk about are things that pertains equipment and technology risk. So some of the time, or most of the time, you come into the OR and you find out that something is not working the way it should work. There are machines, and that can happen sometimes. Although before the surgery commences, one person or two should have picked that problem and get it fixed so that the patient can use it. But sometimes in the middle of the surgery, it can stop working, and it's not your fault, it's nobody's fault. It just stops working. So technology improves care, but introduces risk as well. One of the things is you want to find out about potential issues that can happen, which can include equipment malfunction. Like I said, it can malfunction anytime. What if it malfunctions? Do you have a backup for kind of equipment that malfunctions? What are the plans that you have in case there's a problem? Sometimes equipment drop, and it's very important equipment for that surgery. If you don't have a backup, what is the plan that the facility have of what they need to do? Some facility will tell you you can flash equipment. Flashing equipment means you can take it to sterilizer, do 1 or 2 cycle, and then bring it out, then continue surgery. Some facility will tell you that they cannot. So aside from what is globally accepted, you also want to follow what your facility procedures are. If this is what is being done, what are the things? If this happens, what are the things that we can do to continue the surgery? Then you also want to talk about improper use. Sometimes it's not like the equipment are not functioning. Sometimes the person using it does not know how to operate that equipment. That is why it's good to do continuous education on equipment that are new. If you have new people in as students that you are, when you get into the OR, you want to find out what is this equipment, how does it work? You don't want to assume you know, because sometimes it might be the same equipment that you know, maybe they have the same name, but they work differently. So you want to find out, be curious enough to say, show me how it works, so that you know exactly how that particular equipment works. Then, of course, in the inadequate maintenance, they're not maintaining the equipment properly. Cords are flying all around. People can trip on the cord and all of that. As a student, if you find out that there's anything faulty or something going wrong, even with equipment, you should report it. If you find out that all cords are just lying everywhere in the OR, that can cause hazard not only to the patients coming in, if the patient can walk into the OR, but also to people walking in the OR. They can trip on it and fall. So you want to report it and find something. They can find something they need to do so that those things do not trip you as a student and also people working in the OR. Okay. Communication and teamwork is another thing that is very crucial in the OR. Even as a student, like I said, you have the onus of making sure that you talk to people in the OR and they talk to you as well. If you see things going well, ask questions. If you see things not going well, you want to tell them that, is this how it's supposed to be? So effective communication is essential for safety, both for you as the student, as the worker, and also for patients as well. For best practices, you want to use SBAR communication. SBAR means that it's just an acronym. The S is situation, the B is when you find out about the background, and then the A is when you find out about what are the things you do, and then recommendation as well. So you want to find out about, you want to follow these things and then find out about the situation, the background, and all of that. And then that will help you to channel your thoughts on things like you're talking about in the OR so everybody understands. You just don't want to be talking and everybody's like, what's this person talking about? Then you want to perform a closed loop communication. Closed loop means that this person is saying it and this person is repeating it, and then they're saying the same thing. Just like how, armed forces, how they talk, and then they're saying Roger that and all of that. Making sure that everybody is on the same page when they're communicating in the OR. The surgeon is not saying A, and the anesthesia provider is saying B, and then the nurse is saying C, the student is saying D. Everybody is just disjointed. Making sure that everybody is in sync. Then team breathing and debriefing. So team breathing and debriefing means that before anything at all, we talk about what we want to do. That's breathing. Okay, this is what we're going to be doing. The patient is going to be doing this. Depends on facility. We do that in my facility. We talk about it. This is what we're going to be doing, and this is how we're going to do it, and all of that, yada yada. And then once we're done, if things went well, things did not go well, we'll come back again and then we'll debrief what has happened. These are the things that we did. These are the things that we should have done. These are the things that went right. These are the things that didn't really go right. Things like that. Then good teamwork reduces error and improves outcome. I found out that when the team is working together, everybody is talking to themselves, then the error is reduced because somebody picks it before it happens. But when everybody is grumpy to themselves, everybody is not talking, somehow they have some beef going on between them, then most of the time error is likely to happen in that kind of environment. So let's talk about patient identification and consent. Identification means you want to know who this patient is, and then of course you want to take their permission. You want them to give permission to say, yes, do this procedure on me. You want to find out about correct patient identification because this helps prevent serious error that can happen. Just like I said some slides back, if you're not identifying the patient rightly, if you don't know who the patient is, the patient does not know who you are, the chances of error is high. So you want to use something called two patient identifier, which is their name and date of birth, majorly. Their name and date of birth. You don't want to use their room number. You don't want to use their record number and all of that. So you want to find out about their name and date of birth. Then you want to find out or ask the patient to verify the procedure and the site. So if the patient has to tell you, even though they might not know the medical term sort of that they call it, but they should be able to know exactly what they want to do. They can tell you, yes, they want to take away one of my breasts. Yes, they want to take away one of my kidneys. Yes, they want to fix one of my left ankle, my left thigh, whatever it is. And of course, you want to ensure that they have signed and they have informed consent. It's not your job as a student to talk to patients for them to sign an informed consent form. It's not your job. It's not my job as a nurse as well. It's the surgeon's job to come in. I can be there to, if the surgeon has any question or the patient has any question that can be directed to me, I can be there. But it's the surgeon's procedure that is going to come in, talk to the patient, and then, of course, after understanding what the surgeon has said, the patient signs a consent to say, yes, I want to go into the OR and get this done. Students should always verify before proceeding. You want to verify with everything. You want to ask the person you're precepting with, can I come in with you? Sometimes when you get into the room where the patient is as well, don't take it personal if they tell the patient that, okay, this is a student I'm having with me today. Some patient will say, yeah, I don't have problem with that. The student can stay. Some patient will say, no, I don't want student in. So if you have something like that, or if you ever encounter something like that, don't take it personal. It happens, and it's just what it is. Okay, incident reporting and safety culture is the next thing we want to talk about. Like I said, we don't want to put blame. We want to create a system whereby everybody is comfortable reporting incidents, and then we are creating a culture where everybody feels safe. and they don't feel targeted because they made a mistake. For this, they want to report near misses. So near misses means the problem did not happen, but the problem would have happened if someone did not catch it before it happened. So that's what near misses mean. They still have to report that, like, we almost gave this patient, maybe the patient is another kind of blood group, and they're giving another kind of blood group blood. Before it happened, someone picked it. We still have to report that. Then reporting is not punitive, should not be punitive. In fact, most countries have a kind of line that you can report this to if you reported something and then they're punishing you for it. It should never be punitive. It should be done in such a way that everybody feels safe to talk about it. Then you want to focus on learning and prevention. So I used to say this: if something happens, for example, maybe I made an error and it has happened, I shouldn't start wallowing in what I've done. It has happened already. I should see that as an avenue for me to learn from what I've done. What are the things I should start looking at next time, so that does not happen again? Then a strong safety culture encourages transparency. If everybody is scared of reporting, if everybody feels like they're being punished because they report, nobody's going to report. And I got all of these from one of the series that is going to be held 2026 for AOR, and I don't know if you have subscription for that, but it is a subscription thing. You have to subscribe to be able to read all of that. Okay, what are your roles as students in patient safety? This is where one of the things that concerns you the most. What are the things that you should be able to do, or what are the things that you should do as a student that concerns safety? One of the things is you want to follow protocols and guidelines. Follow protocols and guidelines of the hospital, of the organization, wherever it is that you are. If they say put on this attire before you enter the OR, make sure you put in on that PPE. If they say wash your hands, make sure you're washing your hands. If the person you with maybe precepting you says stand on that side because we don't want you to contaminate the sterile field, please stand on that side. Don't feel like they are kind of being mean to you. They're just trying to make you follow protocols and guidelines, which you should follow without resisting. You want to ask questions when you're unsure. Like I said, if you're seeing things that you don't understand, that's why you're a student. You want to ask questions. Why are we using this? Why not that? Why not this? Why not that? Be curious when you get into the OR. That is where you can also learn. Then you want to speak up about concerns. Like I said, if you find something going wrong, speak up about it. Say something. Maybe, who knows? Maybe you're saving the patient's life right at that moment. Then you want to maintain professionalism and vigilance. You just don't want to be vulgar in the OR. You don't want to be, you want to be professional as much as possible, and then you want to be vigilant. You want to make sure that your eyes is spanning right, left, and center to make sure that everything is going well, even though you're a student. All right, this is where I would need you to mute. If you don't mute, I'm not going to continue because it's a small case study and I just want to ask a question. So you as a student, you notice an unlabeled syringe on the sterile feed and you are asked to administer the content of the syringe to the patient. So I need 3 people or more than that to tell me, what do you think are the risks for you doing this for the patient? What should you do as a student and how can you prevent this in the future? So I need 3 people. Unmute yourself and talk to me. What are the risks, what you should do, and how you can prevent this in the future? I'm waiting.
The risks will be absence of sterile field, and the patient might have infections if we use it.
Okay. Yeah, I agree. You don't know how the person has, the person that withdrew the injection, you don't know how it was withdrawn. You don't know if the person used a clean procedure and then it's contaminated and then you put it into the patient. You don't know if you're supposed to clean the hub. That the hub is where the cannula is, and then you want to put the content of the syringe. You don't know. And then, yes, that can cause issues for the patient. You don't know how long you should push that medication. You don't know if you're supposed to mix it with something and things like that can cause phlebitis, the vein is inflamed, and all of other things that can happen. Yeah, I agree. So what is another risk? Somebody else talk to me. What are some other risks that can happen for when someone says push that medication that you don't know what's inside? What are the things that can happen?
Ma'am, if the medication is wrong, which is administered, it may cause harm to the patient. It may be
Yeah,
fatal.
yeah. The patient can die in seconds. You don't know what's in the syringe, and you push it into the patient's vein, and then you see the patient, gasping for air, and then the patient dies. You don't know. So yeah, I agree. So the next one, I need someone else to answer that. What are the risks? What should the student do? Sorry, what should you do as a student if someone says this to you? Somebody?
Ma'am, the patient should ask benefit administer about it, ma'am, and should report about the syringe which is been found in the sterile field.
Hmm? Yes. So someone says, take this and push into the patient. Say no, loud and clear. No, I don't think I should do that. I did not withdraw the content inside that syringe. I don't know what's inside that syringe. As well, I am not putting on, you're not sterile. And then they want you to take something from the sterile field, you can contaminate every other thing there. So no, you cannot. So say it loud and clear. Don't be scared to say it. No. Let it echo in the OR, let everybody hear. No. All right. What do you think you can do to prevent this from happening in the future as a student? What can you do? What are the things you should do?
Label the drugs and the syringes.
Okay, yes. So
Ensure
if
it will not happen in the future again.
yes, yes. So if they want you to do this, then you should be the one withdrawing this medication. That's one thing. Yes. Think about sterile field. What are the things you can do in future?
Yes,
I mean,
not food.
if we don't know about that drug or what's the content in it, that so we should ask our senior or any senior faculty.
Yeah. Not just your senior alone. Ask the provider, whoever it is that is in charge of it. You just don't want to do what it's not you that started. You don't want to finish it. Whoever it is that started it should finish it. Think about school-wise. What are the things you think you can do back to your, teachers, your professors back in school? What are the things you can talk to them about with this? Anybody knows?
Yes, Mumbai Center.
Okay. So what I'm saying is, when this happens, you want to go back to your, faculty, to your teachers, to your professors back in school and report this as well. You're not reporting to make them think that the facility is doing something bad or things like that. You want to report it because you know it's wrong. So they can talk about it like, student cannot do this. These are the things or expectation that we expect from students. So you just want to report it back to your professors, back to your teachers, because they need to know, and then they can stop something like that from happening in the future. Great. Okay. So the next thing we're talking about are ethical and legal responsibilities. Of course, we're working with patients. Remember, I said most patients are getting aware of their rights now. So you want to make sure that you're doing everything as much as possible to make sure that their ethical and legal rights are not compromised. And one of the things that we have as healthcare professionals, which you're going to be as soon as you're done from school, is duty of care. The patient relies on you. The patient knows you're supposed to care for them. You must care for them as much as you can within your power and within your scope. Then you're a patient advocate. You want to advocate for patient. Remember, we said most of the time patients are sleeping. You want to advocate for this patient to say, do you think we should use a belt? Do you think we should use paddings? Do you think we should use anything that you can advocate to help the patient with, to make sure the patient feels good, even though they're sleeping, are things you should be doing, even as a student as well. Accurate documentation is very important. Maybe you found out that during the process of surgery, they opened an extra drape or open an extra ratek, and then maybe the person that's supposed to count on the body is forgetting. You can raise your hand and say, we've not written the ratek that's been just added on the sterile field, so that they can write it down even as a student. Then accountability for action. If there's anything that happens, be accountable. Don't feel bad about it. There was a time of students, although this person is a medical student, was in the OR, and then they brought in the medical student beside the surgeon to come see what's going on. But this medical student wears glasses, and somehow, because she wanted to lean on to see what's happening, the glasses she was wearing dropped right on the sterile field. So thank God that it was not on the site they were operating on, but it dropped right on the sterile field where they draped the patient. So the first thing that they had to do was move this student back. The scrub person took the glasses somewhere, and then another person that is also helping, which is the assistant, had to redrape that side, and then the person that took the glasses off had to go out, undrape, and then had to do all of that again. And then the student felt bad, which is in some extent makes student feels bad, but there's nothing she could have done to that. It happened. Next time she already knows is either she gets something to help her glasses stay so that when they're operating it doesn't fall off, or maybe she gets a contact when she's coming into the OR. What I'm saying in essence is when things happen, take accountability for your action. Don't feel bad about it. It happened already. It has happened. There's nothing sometimes that you can do about it. Okay. Evidence-based safety strategies, these are things that have been done or they've seen that helps. And one of them is the use of checklists. Remember the checklist we talked about the other time. Some facility use some different kind of checklists, but whichever that anybody use, make sure you're using checklists to make sure that you're keeping the patient safe. You want to continue to train the team and also do simulation. Sometimes you see hospitals and facility run simulation, they run training to make sure that everybody is prepared and everybody knows exactly what to do in case something like this that they're training for happens. Then standardized protocols are being used. You shouldn't be using, so for example, maybe you have 3 general surgeons, for example, and this person does this this way. Although every surgeon does their stuff a little bit different, but there should be some protocols that are standardized across board for all of them so that nobody is confused with what they need to do. And of course, continuous education. You want to continue to educate yourselves. We have a lot of turnovers going on, so when another person that is new comes, you want to train them again on what's being done in the facility, and everybody's on the same page. Okay, what are the future direction of the operating theater safety? What are the things that we think you should be doing in future or from now going forward that can help? Simulation-based training, like we talked about, you want to run the simulation like, for example, you can run a simulation for someone that is going to have a cesarean section. What everybody should be doing, everybody knows their role when that happens, especially if it's an emergency. Everybody knows their role when something like that happens. Then advanced monitoring technology, what are the things that they can buy or you can advocate that the management buys into the OR that they can start using to help the patient or to use in monitoring the patient so that they know when there's something going wrong. Then of course, strong safety culture, like we talked about, there should be a culture that everybody feels safe in the OR. Everybody can talk about everything in the OR that pertains to patients. Although sometimes there might be other kind of talks that really does not pertain to the patient, but we should try and bring ourselves back and say what we are doing is about the patient, and then we should talk about things that can help keep the patient and of course ourselves, use students inclusive, safe. Then ongoing quality improvements, making sure that everybody knows what they need to do, making sure that people that need to come see is infection being controlled here, come in to do that periodically, making sure that people come to see are people getting their rest, are people getting their breaks, and all of that, are doing that so that nobody feels fatigue and then causes error in the OR. So some takeaways from here of all the things I've talked about. Remember, patient safety is everyone's responsibility. It's yours, it's mine, it's a surgeon, it's everybody is our responsibility. Nobody is exempted from patient safety. Then the operating theater is a high-risk environment. Like we talked about, most of the procedures taking place in the operating theater are invasive, so that makes it a high-risk environment. You want to make sure that everything we're doing is sterile as much as possible. We're reducing flow of personnel as much as possible as well. Then system helps prevent errors. When the system is being done properly, when the system is being the system is done in such a way that everybody the system is working, then errors are being prevented. So if error continues to happen, then you want to check the system to find out exactly what is causing the error. Then students are vital member of the safety team. Like I said, students are very important. Sometimes they're very alert as well because they're very curious, they're vigilant, they're looking here and there and finding out things. And one thing that I want you to take away from all of this that I've said today, if there's nothing you're remembering, is if you see something, say something. Always say something. You don't know what you're doing or what's the problem you're saving because you said something. So do not think that I'm a student, my voice do not count. It counts. So if you see something, we need you to talk. We need you to say something so that everybody is on the same page and everybody's doing things that keeps the patient safe. These are some of the references that I used for this, and this is where I stop. And I want to ask if we have any question. I'm open to questions now. Back to you, sir.
Thank you so much. We have a question from Mazumdar. The question is, ma'am, if we can use two-way cannulas, then why should we use two different cannula which increase the risk of infection?
If you can use two cannulas, oh, can you say that again?
Yeah, the question is, ma'am, if we can use two-way cannulas, then why should we use two different cannulas which increase the risk of infection?
Okay, so why we talked about that cannula thing is, I don't know if you saw the caveats before that. If the patient has a risk of losing greater than 500 mils of blood, or if the patient is a child and the patient can lose up to 7 mils per kilogram weight of blood for the child, then you want to have two cannulas because you're not having a cannula because we know that it's a risk, but you're having a cannula because you're trying to save the patient's life in case there's a problem. So in case the patient starts bleeding, for example, you want to use one of those access for fluid that can serve as expander for the blood, and the other one you want to use to push medication. You need to push blood or give blood and all of that, then you use the other one. But like I said, once you see that the patient is stable, everything is fine, most of the time you take away one of the cannula and they leave one should always be in place just in case anything happens in the PACU. When they get back to the floor, you don't want to start looking for access. So you're having that because you want to, it's a life-saving means. Just in case anything happens, you want to be sure you're ready to take care of that. Did I answer the question?
Perfectly.
Okay.
Yeah. Do we have any other question from any center? Please raise your hand so that we can connect with them.
Any question? Clarification?
Any clarification you require? Any questions you have?
I see someone
Yes.
raising their hand.
From Srinagar Center, we have a question.
Okay.
Please go ahead.
I can hear.
Yes, please go ahead. Tell me your question. You're not audible. Your voice is not coming. Can you please text it in the text box?
Yeah, your voice is not coming out.
Nilofer in Srinagar Center, there isn't some microphone issues. We don't have this. We are unable to hear the voice. So coming to the Kolkata Center, do you have questions?
I think
Yeah.
I see one. I see one in the chat box as well. It says, how do we identify potential risk involved? Yeah, great. So one of the things I would say is, first, you should know the kind of surgery you're doing. I used to advise, even as students, when you have access or you know the surgery you're doing beforehand, even if it's 30 minutes beforehand, read about it. If you don't know about it at all, read about it, ask questions about it. When you read about it and ask questions about it, you already have an idea of what is being done. So if you think something else should be done or should be added to what they're doing already, you start thinking about it like, okay, why don't they have this, or why do they have this? And if it's something you don't know, no problem. Just go with the flow of what they're doing. By that, you can start thinking or start picking what they're doing. Next time when you see something like that, you know when something is missing, and then you can advise them on what they can do when you find out that something is missing.
We have one more question. How student can contribute a safety culture?
Okay,
Like
so
a student is on internship, how a student can contribute a safety culture in OT?
yes. So like I said, even as a student, when you come into the OR or the operating theater, one of the ways you want to contribute safety culture is, one, you want to follow their principles, follow their policies. If it's a place where you have to wash your hands, if it's a place where you have to use their complete PPE, use your mask, use your headgear, whatever it is that you need to wear. Sometimes you cannot put on the shoes that you're wearing from your home into the OR. You have a designated shoe for you, or maybe they have something you have to put over your shoe to come into the OR. Make sure you're doing all of these and following their principles and procedures that they do. At the same time, like I said, if you find out that there's something going wrong or you know something is not right, speak about it, talk about it, like ask questions. Why is this here? Why is that here? You don't know exactly what you might be saving at that time. Also, like I said, you want to read about some things. If you find out that there are things that ahead of time what they're going to be doing, read about it. It gives you a kind of clue of what you should expect, and then you know the question you're supposed to ask, and you're asking the right questions.
So the another question is, in case of emergency, can we operate on the patients without knowing potential risk or complications?
So sometimes in emergency, something can happen, just like you said, it's emergency. You're trying to save the life of the patient. So for emergencies, every facility knows exactly what to do depending on what the emergency is. So if you as a student doesn't really know, just follow the trend of whatever they're doing, and then if there's any risk that happens during emergency, they try as much as possible to save. For example, if it's bleeding, maybe the person was, there was violence somewhere, the person had a gunshot, I'm just using that as an example, and the patient is bleeding. Sometimes they try as much as possible to save that bleeding, but sometimes the problem might be too much that they cannot save that patient. They try as much as possible. It's an emergency. You don't know exactly what's going to go wrong, but they try as much as possible to do all that they can do. Sometimes you hear them say something over the address system, like they need a lot of blood. So it's mass casualty. They bring in a lot of blood. They're transfusing. They're doing all of that. And you remember what I said the other time as well. When there's an emergency like that and they're transfusing and giving a lot of fluid, you don't want to throw these bags away, because after the patient is stable, for example, you want to be able to go back and say, this is how many blood units the patient had, this is how much fluid the patient had. So sometimes they might not be able to save, but they try as much as possible to do what they can in the OR and save the patient.
So thank you. Thank you so much for the insightful session. So the questions, students, in the next session, we will start from Q&A. So today the timeline is not allowing us to go far beyond that. So as we are concluding the today's session, we sincerely thank the Operating Room Global for its outstanding contribution and to the global operative systems and operative educations. We extend a special appreciation to CEO, Professor of TORG. So before we close, it would be an honor to invite the CEO of the Operating Room Global to share a few closing words of wisdom with our audiences. Please, Professor, if you're available, we want you to share some words of wisdom with our audience.
Thank you so much, everyone. I hope my voice is audible enough. I want to say thank you so much, Assistant Professor Zakia. Thank you for the honor. Thank you for the invitation. Firstly, let me start from our speaker, Assistant Professor Oluwatoyin Akinlade. Thank you so much for that clear, insightful, and practice-driven presentation. Sorry, my camera is off. It's very early in the morning in Ireland, and greetings everyone from wherever you are connecting from. So I must say that that presentation was actually highly relevant, and it was also timely as well, because patient safety and risk management in the operating room environment, especially in today's complex surgical environment, is highly needed. And the speakers highlighted critical principles that actually resonate strongly, not just with students, with professionals as well, with the global audience, from proactively identifying the risks as she has explained, and to team communication as well, to accountability in the operating environment, to a culture of safety, which is really, really important. And I want to use this opportunity to say to everyone that everything that has been discussed today is not just abstract concepts, but they are practical tools that everyone, regardless, either you are a student or you are a professional, you can apply immediately within your own institution. So I want to say, on behalf of the Operating Room Global TORG, I want to say I sincerely thank everyone. Thank you, the speaker, for sharing your expertise, for sharing your experience and your perspective with the community. And I'm also using this opportunity to say we acknowledge Emversity India, all chapters represented, all the students, we acknowledge you, all the leaders and the leadership of Emversity as well, and that of the Operating Room Global TORG India chapter, Dr. Krunal Soni, the director, who has actually given the permission to go ahead with this collaboration. I want to say as well, we say thank you to everyone, all the participants joining from different parts of the world. Thank you for your presence. Thank you for your commitment. It's only the beginning. Better is not good enough. The best is always yet to come. So hopefully we have more sessions once monthly, and we will be happy to more than support and promote the activity. Thank you so much, Professor Zakia.
Thank you so much. It was nice interaction. Everything was relevant to the students. Now we have one student from Mumbai, Shreya. I'm inviting you to do your conclusions the way you want.
Hello. Good afternoon, ma'am. Good afternoon, sir. Today in this session, I understood and I want to give the conclusion that if we practice IPSG, we can enhance patient safety. And in IPSG 1, we should follow that, identify the patient with correct name and UID number. We can identify the wrong surgeries planned for wrong patient. IPSG 2 is to improve proper communication. We can avoid the wrong medication administration, and we should always follow the SBAR. IPSG 3 is improve the safety of high alert medications. In this, all the medications should be labeled. And IPSG 4 is ensure safe surgery and safe surgical procedures. We should follow sign in, sign out, and time out, and use surgery checklist. IPSG 5 is we have to reduce the healthcare associated infections, which is proper hand hygiene and surgical site surveillance. We should follow this all. Thank you.
Thank you so much. Thank you, everyone. Thank you, ma'am. It was nice interacting with you. So next session will be on 20th, will be on 10th of January. It will be for medical laboratory and technology. Thank you so much, ma'am. It was nice. And we are going to conclude this. Thank you so much, everyone. Now we can drop the call. And after this session, I have shared a feedback with you. Kindly fill the feedback and give your proper insights. How was the session? Thank you so much. Thank you, everyone.
Thank you all.
Thank you, sir.
What?